Hello, Kauai. Here's our COVID-19 briefing from Team Kauai for Wednesday, January 6th. The Department of Health is reporting 2 new cases today. One is an adult male visitor and is travel-related. The other is an adult female resident and is community acquired. We currently have 15 active cases. All are in isolation and 1 is hospitalized on Oahu. We have 26 people in health-directed quarantine as close contacts. Our cumulative case count is now 182, including 155 confirmed locally, 1 probable, and 26 tested elsewhere but reported after arrival on island. Kauai Police and the National Guard are tracking nearly 1,900 people in travel-related quarantine. Our amended Emergency Rule 23 and our new Emergency Rule 24, which changed the quarantine provisions for travelers, are now in effect. The amended Emergency Rule 23 reinstates the Safe Travels program for inter-island travel. This means inter-island travelers are exempt from the 10-day travel quarantine with proof of a negative COVID-19 test taken within 72 hours before travel. As part of the Safe Travels program requirements, travelers would need to register with the Safe Travels program, and the test would need to be administered by one of the state's trusted testing and travel partners. Test results must be uploaded to your Safe Travels profile before departure. Travelers from out of state can participate in this program after they have spent at least 3 days on another Hawaiian island. They are exempt from quarantine on Kauai if they spend at least 3 days on another island and then take a negative COVID-19 test prior to travel to Kauai. As an example, if an out-of-state traveler arrives on Oahu at 8 a.m. Monday, he can take a pre-travel test from a trusted partner after 8 a.m. on Thursday. Once he receives a negative test result, the traveler can fly to Kauai anytime within 72 hours of taking the test and be exempt from quarantine. Our Rule 24 offers another option for travelers flying into Kauai from out of state. Rule 24 would allow incoming travelers to take a pre-travel test, stay in an enhanced movement quarantine or resort bubble, and quarantine for 3 days, then take a post-travel test to be released from quarantine upon negative test results. This program is independent of the state's Safe Travels program, so tests can be any COVID-19 diagnostic tests, including antigen or PCR tests, with an emergency use authorization from the FDA. We have different quarantine rules for inter-island travelers and out-of-state travelers at this time because of the significantly different risks. COVID-19 disease rates are many times higher on the mainland than in Hawaii, and therefore the risk is higher. Our rules recognize the different risk levels by adjusting the quarantine requirements. These programs are optional. Travelers who choose not to participate in these programs will be subject to the full 10-day traveler quarantine and cannot leave their rooms until after the 10th day. Residents can also choose to take this 10-day quarantine at home. For more information on the state's Safe Travels program or to view the list of trusted testing and travel partners, please visit hawaiicovid19.com/travel. For information about travel to Kauai or to view the full list of emergency rules, please visit kauai.gov/COVID-19. The county has digitized the Kauai arrival form, which is a form that must be completed by anyone entering quarantine on Kauai. That includes travelers entering the enhanced movement quarantine, anyone entering the full 10-day quarantine, and those in a modified quarantine program. It does not apply to inter-island travelers who utilize the state's Safe Travels form to be exempt from quarantine. The new digital Kauai form can now be completed online, saving time at the airport on arrival. It is available at kauai.gov/COVID-19. The state has launched a new COVID-19 management tool, Aloha Safe Alert, which lets you know when you may have been exposed to someone who tested positive for the virus. Should someone test positive, they will receive a text message from the Department of Health that allows them to anonymously and privately share their result through the Aloha Safe Alert app. Within 48 hours, the other app users who came into close contact within 6 feet for at least 15 minutes in the past 14 days will receive a notification of the exposure and will be asked to call their primary care physician, self-isolate, and monitor their symptoms. The new app was developed locally by the State Department of Health in partnership with the Hawaii Executive Collaborative. It was piloted on Lanai and in Hana on November 17th and expanded to Maui County on December 16th. Hawaii Island introduced the app on December 30th. The app has now been downloaded more than 14,000 times. You can get the app for free on any iPhone or Android phone. To download the app, go to the Google Play or Apple App Store on your phone. For more information, please visit www.alohasafealert.org. Aloha Safe Alert uses a Google Apple exposure notification system and uses Bluetooth technology to measure the closeness and duration of signals between enrolled smartphones. The smartphone exchanges anonymous codes that are frequently changed, and it does not keep track of any geolocation or GPS data. You can opt in or out at any time. No one can see your identity, and personal data never leaves the phone unless you choose to share the information. Studies on the technology suggest that if just 15% of our community uses Aloha Safe Alert, we can reduce infections by 8% and deaths by 6%. And for every 2 downloads, 1 infection can be avoided. There may be other notification apps, but Aloha Safe Alert is the Hawaii Department of Health's official exposure notification. Please consider downloading this app to add another layer of safety to help protect your loved ones and our community. We continue to vaccinate healthcare workers, first responders, and frontline workers. As additional vaccine shipments become available, we will expand the list of eligible residents to include our kupuna ages 75 and older, those who have chronic health conditions, and other essential workers. Other groups will be offered the vaccine in the months to come. At this time, there is no COVID-19 vaccine approved for children. If you are a healthcare worker or first responder who has not yet been registered by your employer or the Department of Health, please call 808-346-9605. Providers and staff from practices such as dentists, physical therapists, mental health professionals, and other non-physician practices are welcome to register for vaccination. For more information on Kauai's vaccine distribution program, please visit kauai.gov/vaccine. Mahalo for understanding the role you play in mitigating the spread of COVID-19 on our island. Please continue to stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, maintain a distance of 6 feet of separation and wear a mask, if at all possible for you to do so. Remember, my mask protects you and your mask protects me. It's a sign of respect and aloha. Do not leave home if you are sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Be kind, take care of one another, God bless, and aloha.